Hey everyone, it's Dr. Rick. This unboxing is going to be on topical medical cannabis use. And I got three things, one of which I picked up in Colorado, or at least I used in Colorado when I took a hiking excursion team up there. I tell you, I didn't know how to use it. This was a couple years ago, and American Medicinals is pretty decent. It's a pump. The pump you just spray once, pump once, and it comes out as a cream. You rub it between your hands and you put it on your back, and you feel the effects of the menthol. You might or might not feel the effects of the CBD. So all of the medical cannabis products in Illinois have to have a biochemical profile. And that essentially means that it has to be broken down as far as all of its cannabinoids, and the most important ones for figuring out how to purchase what is the ratio of CBD to THC. This one happens to have all CBD. So I believe it's 0 THC, which I'm not sure how they came up with that because it is medical cannabis and there has to be some form of THC, but I haven't called the company yet. Anyway, this is all CBD. I do not think that you'll have the psychogenic effect that smokers and vapors and edible or concentrate users will have because, again, no THC. But just remember, CBD, cannabidiol, which is a cannabinoid. Cannabinoid is just a fractionation of the plant, the active ingredient of the plant. CBD does get to the blood as far as stimulating the immune system with CB2 receptors on the immune system. And it does get through the brain to stimulate or work on CB1 receptors of the brain. So it does cross the blood-brain barrier, but as far as giving you the psychogenic effect, probably not. Now I felt, this is my story, when I finished a big hike, we went back to the chalet in Colorado. I took a shower and I put this stuff all over, assuming because I was really sore from that hike or from that ascent. I figured I'm in pain, so I might as well use the whole thing. So I covered myself like a moisturizer. Not a good idea. Because of its menthol, I was overly cooled for at least 2 to 3 hours. Now the other question some of you will have is, well, maybe that was a CBD, and maybe, I don't know. But I would only use this sparingly. So you essentially just pump it, you squeeze it out onto your hand. It has to have menthol, so you have to watch your hand to eye contact, and then you put it on your trigger points of pain. I would use it limitedly to one spot, one region, one area for at least 5 nights or twice a day for 5 days. Whatever you choose, try to do that without any other variables to see how it affects you. And just in case, okay, for some of you who are super sensitive or you're using THC at night, street-wise or recreationally wise, you do have to assume that there might be some entourage effect between the topical that gets into the skin and your THC that you used. So just be careful. It might accelerate the effect. But you should always have your rescues, and that's why I have these rescues here. So your rescues will be, anecdote, half of a lemon or a full lemon squeezed, black peppercorn ground up. I usually just take this, grind it up, or tell my patients to grind. Obviously, I didn't break it yet. Tell my patients to grind it up and then put it in the lemon juice that you just squeezed and take that in. Now, there's no overdose of those two things, so you don't have to worry about that, but it's supposed to neutralize the effects of the THC. Essentially, it blocks, like these two things. These are hemp-based CBD and CBD-dominant medical marijuana. So both of these, you can probably see, in fact, here, there. You can hopefully see that the content here is dominantly CBD. There is some THC here. In the hemp-based product, it doesn't have to say THC CBD breakdown because it's over the counter. So you'll just have to assume that with the amount of CBD in here, that it will neutralize your THC. So what these things do, THC is the part of the plant, if you take it at night or you take the whole plant, part of the plant that gives you the psychogenic, or makes you a little high, dizzy, forgetful, fatigued. So some people that might be good for PTSD sufferers, but for non-PTSD sufferers or people who are older trying to take care of rheumatoid arthritis or fibromyalgia, they're already off and fatigued to begin with, so we don't want extra. that will rescue you. It takes the THC, which is supposed to be converted into something called 11-hydroxy-THC, another metabolite, and it stops that. So it'll hopefully help you get rid of your high effect within 30 minutes, I think. Again, you can't really overdose on the natural things. You can't really overdose on hemp. You might overdose on the low THC medical CBD, but that's the rescue. You should always have it around. Or you can just sleep it off or have a friend hold your hand. So now into the topicals. So we'll start with, we already started with the topical cooling effect of all CBD. That's Mary Medicinals. This is Pain Be Gone. I already opened that up, so it's technically not unboxing. This is Pain Be Gone. This balm is mostly THC, but here, the exact breakdown, and the type is so tiny. I can't read that myself without my glasses, so I'm squinting. THC 100, CBD 0. So it's just the opposite. This is all CBD. I doubt that you see that, but if you can read, great. This is all THC, Pain Be Gone, and this is how it looks. If I can open this up, I'll just try to open it. This is how it looks. So that is a balm. It smells a little bit like marijuana, but it also I can smell the oils. I don't know which oil this is. And I have seen some people online make their own. The only problem with making your own is that you can have a problem with getting the exact percentages or biophysical profile, or biochemical profile. So I don't know if it's, and the THC might not be activated. So you have, the THC has to go through this complex process of decarboxylation to be activated. You might not get that if you don't heat it properly. I'm hoping that the companies have done their job. So you will get the CBD product if you make it on your own through the skin, but if you're looking for something else, it might not get there. So again, this is mostly THC, this is mostly CBD. And finally, this is lotion. This is about half and half, 100 of CBD and 100 of THC. So this is half and half. So this would be, if you look at my previous video on cannabis colors, this will be red. This would be indigo blue, and this would be green because it's 1-to-1, if you can see that, great. And this one, in addition to it being 1-to-1, it also, this doesn't even smell like cannabis, it smells like a spa. This is nice oil. But this also has cayenne. So it could be that the cayenne, I don't know if you can get the color of that, that's kind of too much light in here. Maybe that you just got it, but this is kind of salmon colored. It smells more like the cayenne than anything, or the oil. But this is hot. This is hot. This is neutral. And this is cold. So just these are options. And the way I would play this would be that you use, again, you pick your 5 days straight, and if you're going to use topical, I really don't think you have to worry about, even with the mostly THC one, you don't have to worry about it crossing the blood-brain barrier and making you high, but use the rescues if you have to. I believe that if you do this 2 to 3 times a day, if you like hot because you have a trigger point and you want to try it, and try it there, same amount, 2 to 3 times a day for about 5 days straight. If you want cool because you have hot flashes at night and you also have a trigger point, or you have arthritis that's hot, then use cooling to your area of attack. But again, 2 to 3 times a day, 5 days straight, no other variables, so see how you will effectively change. And the other variables would be, don't take any extra medicine, take the usual, but don't take any extra, don't do anything new with your diet, don't do anything new with your exercise. And same thing with the 1-to-1. You can potentially get a little bit, because of THC content in here, remember it's 1 THC to 1 CBD, you can potentially get it to cross a blood-brain barrier, but again, if you use your rescues and you're really good, you should be okay. So if you notice good effects with the use after 5 days of your experiment, then cool, you can use it anytime you want. I usually use this as a supplement to my patients who are doing it orally, using the concentrates orally, or using the vapor smoke. They'll have their protocol as far as what to do, but during times of really bad flare-up, I say don't change your formula as far as the vape, smoke, or concentrate, but add this as an extra pain reliever locally so it doesn't add to the CBD that you have internally or add to the THC that you have internally. It just gives you extra relief. This is also very good for skin reactions. Those of you who have psoriasis or eczema, really nice. I'm going to try it on a patient that has Lyme disease and is showing some psoriatic changes, which were thought to be psoriasis, but I really think it's Lyme. So I'm going to have him use this as well, and we'll see how he turns out. But hopefully you'll like this, and if you have anybody that's on the fence as far as not exactly getting what they want from their oral or their smoked or their vaped, and they want extra without having too much of a high effect, then pass this on to them. The other thing too is this can be a little expensive, so you have to use it sparingly. So as I mentioned, I think this is for my patient that I'm a caregiver for. I think it was like 40 to 45 bucks. This one, I think it was same, this one 30 bucks. So they go fast, so you have to use them sparingly. And again, you have to wash your hands after you use these, just in case you have to rub your eyes. And one more thing, the final note is that when you put this on topically, you might still turn positive if you have a drug test. So I know you're not supposed to have that much THC in this thing, or this thing, but you can still turn positive. Now, I don't think you're gonna have to worry about that, but just plan on it. And the addendum, if you have it on your skin and you go and hug somebody that's a DOT driver, you can technically pass it on to them. Or if you hug a less than 21-year-old, you just got them to absorb too, because it'll rub off on them. Technically, even if it's a couple hours later, it can still rub off. So be careful about your exposure. Pass this video on if you like it. Otherwise, subscribe to me down below to when I do other videos, and have a good day.